Here we will discuss how to support breastfeeding after the baby is delivered, how to support the mother regarding breastfeeding. So the support can happen in the labor room after the delivery of the baby, or in the postnatal ward, or at home. And it involves imparting the skill for successful breastfeeding by informed medical care providers or even family members and husband. So the involved medical care providers are pediatricians, obstetricians, doctors, nurses, even medical and nursing students. And the techniques that are taught to the mother involve proper positioning, how the mother positions herself and how she keeps the baby, the position of the baby. And second is a good attachment, that is how the baby is latching to the areola and the nipple for breastfeeding. So coming to the first part, that is the positioning. Positioning involves the position of the mother and secondly the position of the baby. So the position of the mother while feeding should be such that she can assume any position that is comfortable to her and the baby. She can sit or feed by lying down. She should be relaxed and comfortable. Her back should be well supported. She can use pillows to support her back. She should not be leaning on her baby if she is sitting. She can use a nursing pillow while feeding the baby. Now there are various feeding positions, breastfeeding positions. Firstly, you have the cradle position, which is the usual position of feeding. Secondly, if you want to support the neck of the baby because the babies don't have adequate control of their neck, you can hold the neck with the opposite hand by the cross cradle position or by the same side hand, which is called the football hold position. Like a football, you hold the baby on the same side. Or you can lay to the side and do a side lying position for feeding. So first position, that is the cradle position, where you hold the baby on the mother's lap and the baby's head is in the crook of the mother's elbow on the same side, close to the breast, with the neck slightly extended. And the infant's ear, shoulder, hips are in a straight line. Infant's head, neck, and the body are in the straight line. And the baby's abdomen or the tummy is touching the mother's tummy. And the baby's chest is touching the mother's chest. And this is the most common position used by mothers. Now, in the early days, when the baby's neck is not in very good control, you can try holding the baby's neck using the opposite hand. This is called the cross cradle position. It is similar to cradle position, but the opposite hand is used to support the baby's neck and the body. And the same side hand is used to hold the breast. And this is useful for the initial feeding or the initial days of feeding. Some mothers may not be comfortable with the cross cradle position. Rather, they would like to support the baby's neck and the body using what is called the football hold position, where the baby's body is under the mother's arm with the hand to the base of the head and the neck. So the hand which is on the same side as the neck of the baby is used to support the baby's neck. And you can use feeding pillows or usual pillows and help the baby to latch on. This position is useful in cesarean delivery, where your baby does not touch the scar of the cesarean or the wound of the cesarean section. And it's also useful for small baby and also in twins baby, where you feed both the babies using the football position, which is called the double football position. And most of the mothers of twins babies use this double football position to feed both babies simultaneously. Side lying position, where you feed the baby lying on one side. You can use pillows underneath your shoulder, and under the baby you need not keep any pillow. Here also the baby's body, head, neck and body is turned towards the mother, and the tummy of the baby is touching the mother's tummy, and the baby's mouth is in line with the nipple. Cesarean birth, it can be used for cesarean birth, or if the sitting is uncomfortable due to severe back pain, or no assistance is available for latching on during sitting. Then there is a position called the Australian hold position, also known as the saddle hold position, where the baby can be placed on the thigh of the mother, and this is used for older infants, and it's not commonly used by mothers of younger infant. Best used in older infant with a nasal block or ear infection or cleft palate, where it is important that the feeding, the milk that the baby swallows goes straight into the stomach instead of going to the nasal cavity, nose cavity, which can happen in babies with a cleft palate. A cleft palate is a defect in the palate where the nose cavity communicates with the oral cavity of the baby. Then coming to breastfeeding of the twins, the positions used mostly by mothers of twin babies is the double football position. 99% of mothers use this position to feed the babies simultaneously. Other positions that can be used are the football and cradle, then the upright latch position, and the front cross positions. Now, when will you feed the baby? Will you wait for 2 hours or will you wait for the baby to cry? No. You should feed the baby as soon as you realize that the baby is hungry. As soon as your baby shows early cues of hunger, saying, I am hungry in their own ways, their own manner, by steering their head around, by opening their mouth, turning their head, and trying to lick, that is the early cue or sign that your baby is hungry. Then, if you don't respond, the baby may stretch, increase the physical movement, and do a sucking of the baby's hand. That means the baby is really hungry. You should not wait for any more time. And then there are late cues where you may have to calm the baby before feeding the baby, where the baby cries and the body movements are agitated and the color of the baby's face turns red. So you should not wait till the baby cries while feeding. Rather, you should feed as early as possible. Now, the position of the baby is also important. Make sure that the baby is wrapped properly and the baby's whole body is supported, not just the neck and the shoulder. And baby's head and body should be in one line without any twisting in the neck. The baby's body should be turned towards the mother. The baby's abdomen or tummy should be touching mother's tummy. The baby should be held close by mother with neck slightly extended and chin close to the breast. Now coming to the second part, which is the attachment or latching. Now after positioning, proper positioning, the baby's cheek is touched. This initiates a reflex called a rooting reflex. The baby turns towards the breast. Baby's head turns towards the breast. Now allow the baby to open his mouth widely and latch onto the breast, ensuring that the nipple and most of the areola are within the baby's mouth. Now baby is brought onto the mother's breast and the mother should not lean onto the baby. During latching on, the mother holds the baby in upright position on her lap and the mouth is wide open and the chin touches the breast. And the mother guides the nipple and areola into the baby's mouth for effective milk transfer. So when there is a good latching, the mouth is wide open, the chin is touching the breast, is very close to the breast, and the lower lips are turned outwards, and the more areola above is visible rather than below. The cheek will be full. There will be regular, slow, deep sucks, and the tongue will be under the lactiferous sinus, under the areola and the nipple. And the nipple will be very deep into the hitting against the palate of the baby. This is the latch score, which is used by lactation professionals to grade the attachment, how good the attachment is. Now, if the scores are less than 5, it indicates the need for assistance for better success in breastfeeding. Now, signs of good attachment is again, as I told you, baby's mouth is wide open. Most of the nipple areola is in the mouth. Only the upper areola is visible, not the lower areola. And the baby's chin touches the breast, and the baby's lower lip is turned outwards or everted, as shown in the picture. The mouth is wide open, and only the upper part of the areola is visible. Lower part is not visible. Even the upper part is not visible in this picture. The lower lip is curled outwards, and the chin is touching the breast. Now we have discussed what are the signs of good attachment or good latching. Now what are the signs of poor latching? Poor latching means the chin and the nose are away from the breast, the mouth is not wide open, and the baby is just sucking at the nipple, and the lower lip is pointing outwards or turned in, pointing forward or turned in, and the areola is visible. That is the dark tissue or the skin area around the nipple is more visible below than above or in equal amounts. And here what happens is when the baby sucks only at the nipple, it will not get sufficient milk. The baby will be fussy. The baby may have low weight gain. The baby may have low blood sugar. The baby's urine output may fall, and the mother may have crack in the nipple. She may have bleeding from the nipple. So it is very important that the baby attains a good attachment while feeding. So again, in a good attachment or latch, much of the areolar tissue and larger ducts are in the baby's mouth, and baby's tongue is moving forward over the lower gums beneath the milk duct, and the baby suckles from the breast and not from the nipple. Whereas if it is a poor attachment, the mouth is not wide open, the chin is away from the breast, and the baby is sucking only at the nipple. Most of the black portion of the breast is outside the baby's mouth, and the tongue is away from the teat. So effective sucking, when it happens, slow and deep suckle is followed by a visible or audible swallow of 1 swallow per second. Cheeks remain rounded during breast. A satisfied baby usually releases breast spontaneously after around 15 to 20 minutes of sucking. Initially, it may take 15 to 20 minutes, but when the baby grows at around 1.5 months, the baby may become satisfied after around 10 minutes. The nipple may look stretched out for 1 to 2 seconds, but quickly returns to its resting form. So during the period after delivery of the baby, the time should be used to explain about the importance of giving breastfeeding, especially colostrum, which is the initial yellow creamy milk that comes out, which gives the baby protection against infections. And check mother's hydration, comfort, sleep, and rule out stress. Examine the breast for nipple problems like cracked nipple, retracted nipple. Some may have very small nipple or flat nipple. Directly observe the feeding. Check the position and the attachment. Record the latch score. And stress importance of giving both hind milk and fore milk. Both milk should be given. And inform how to assess the adequacy of breast milk. Now, the adequacy of breast milk is determined by the fact that how much time the baby takes to sleep after feeding. The baby sleeps for at least 1.5 hours to 2 hours to 3 hours after each feed, then that means the baby has adequate amount of breast milk. Or if the baby passes urine 6 to 8 times in a day, and the milk flows from the opposite side of the breast, when the mother feeds on one side, then that means the mother is having adequate amount of milk. The baby is gaining the adequate weight around 20 grams every day, and the baby crosses the birth weight by 2 weeks of life, then that means the baby is getting sufficient amount of milk. Now it is very important to burp after each feed. You can burp the baby either by holding on the shoulder or by taking the baby on your lap and patting it gently. Ensure that the mother gets adequate fluid, good food, and comfort, and ensure that the mother sleeps with the baby, especially during days. Switch off all the lights which interface with the baby's and the mother's sleep. There should be adequate privacy for feeding, and sort out any nipple problems. And also there should be counseling of not only the mother, the supporting family, and the husband. So after the baby and the mother is discharged from hospital, they should be advised to give exclusive breastfeeding during the first 6 months. That means no feed or food should be given other than mother's milk. The baby should not receive any other medicine or that is not prescribed by the doctor. And it should be always a demand feeding. The mother should not be giving feed like a robot. Neither the baby nor the mother is a robot to give, and the mother should not feed every too early. Rather, the the baby should be fed as per the baby's demand. So there should be a demand feeding, and you should not wait till the baby cries. As soon as you realize that the baby is hungry, as soon as the baby turns its head towards one and start licking, you should feed the baby, your baby. Rooming in is very important. The mother and baby should be resting in the same room 24/7, and avoid using pacifiers or formula feeds unless medically indicated, and avoid using bottle feeding. And immunization is important, and the mothers should be told, the parents should be told about the danger signs that they should watch in the baby. In case if these danger signs are present, they should take the baby to the doctor as soon as possible and follow up with your doctor so that you can know that your baby is growing adequately, baby is gaining weight adequately or not. The contact number of the lactation counselor should be also provided. So the mother's breastfeeding desire and the baby-friendly hospital care, informed medical providers who can teach the mother regarding the position and the attachment, and supportive family and friends will lead to success in breastfeeding. Thank you for your patient listening.